I'm Sigrid Lokensgaard. I am Team 23, and this is the project that I made. So I decided to address prompt 3, working on maximizing the effectiveness of any vaccine at the time that it came out. So the number one priority in that case will be finding the areas in greatest need of the COVID-19 vaccine. Now, the growth of any infectious disease follows a logistic curve, meaning that the slope or the rate of infection is going to increase the most in the middle, or when 50% of the population has yet to be infected, but 50% has already been infected. So my program uses data about the total number of persons in a given region, the total number of those people who have been infected with COVID-19, the current number of people in that region who are currently infected with COVID-19, the amount of time until a vaccine will be available, and the extent of preventative measures against the spread of COVID-19 in place at the time the program is run. So, for looking at the main method here, I did code this in Java. I start by declaring my variables, but this section of code here gathers user input on what is currently known about the region so that the program can make its calculations. The first division in the route that the program will take will be based on whether the region is in full lockdown. If it is in full lockdown, then since the transmission rates for full lockdown are fairly well understood, according to a study I found on the United Kingdom, the program can then calculate how many more infections it can expect to have in that region until by the time the vaccine has been completed. And then it can rate that area's need of the vaccine as either lowest, low, moderate, high, or highest. Ideally, the highest need areas would be sent the vaccine first, and then the lowest areas last. That would ensure that the vaccine was delivered in the most efficient way possible, where it could prevent the most new infections of COVID-19. If the area is not locked down, then the other preventative measures will also be factored into the amount of expected cases, and that expected cases will again be evaluated to see how close it will be to that 50% number. If it's close to 50%, then those regions are of highest need. If it's far from 50%, either above the herd immunity threshold at which the disease effectively ceases to spread, or below the level where the number of new infections is significant, then it's of lowest concern. Ideally, public health agencies could use a program like this to constantly update information about every region they had as lockdown conditions changed and as number of infections changed, so that at the moment that a vaccine became available, it could immediately be dispatched to the areas of highest need, followed by high need, followed by moderate need, and then the lower need areas, ensuring that the greatest possible number of COVID-19 infections are prevented.